Hello, Rebels. Welcome to the base. Steve Hilton here. Kristen Garcia-Dumont with me today. How are you, Kristen?
I am fantastic, and I'm so excited about our guest today because he's one of the few sensible voices about lockdowns and COVID, so I'm psyched.
Well, there you are. So that's what we're going to be talking about. It's such a big issue. It's still such a big issue. We're nearly 2 years now since the first case of coronavirus. And we're still in the middle of all these debates about vaccine mandates and lockdowns and how we live our lives and when we get back to normal. It's just unbelievable that we're still in this. And so I wanted to talk to someone who right from the beginning has been such a voice of reason and science, and actually a very brave voice, because so many people in his scientific community have been following the groupthink. Here's someone who's stood up against the groupthink from the very beginning. And I'd love to ask him, I've got so many questions to ask him about where we are now, but also how we got to this position and where we go next. I'm talking about Dr. J. Bhattacharya, Stanford University. If you watch my Fox News show, you've seen him there. You've seen him all across the media. If you follow the Great Barrington Declaration, you'll know that he's one of the founders of that. I'm sure we'll be getting into that as well. So let's welcome him right now. Jay, great to see you.
Thank you for having me.
So let's just start with where we are right now in this pandemic and the big debate that's going on at this moment, which is about the vaccine and the mandates around the vaccine. And there's two types of mandate that I'd love you to address separately from your perspective, if that's okay, from a scientific point of view, which we rarely see these days. It feels like so much of this is now political and ideological. But from a scientific point of view, there's the mandates that are being imposed on adults, top down from the Biden administration, employers and so on. There's a whole kind of world of vaccine mandates going on, imposed on adults. And then you've got the mandates on children. And I do want to talk about them separately. You take them in whichever order you want, but I think they definitely require a different kind of analysis. So what do you think?
Sure. So why don't we start with adults? The first thing about the vaccines it's incredibly important to know is that there's two kinds of effects you can think about from vaccines. One is a vaccine that protects against all infection and spread of the disease. And then the second is a vaccine that protects against severe disease. So if you get the vaccine, you're much less likely to get hospitalized or die from the disease. What's become apparent from the data is that this vaccine is actually quite good against severe disease. You know, months and months and months after you get it, you're still protected against getting hospitalized or dying. But it's not so good, especially after a few months, against getting infected. You can get infected and you can spread the disease even though you're vaccinated, which makes it different from many of the other common vaccines in use, which protect you against both infection and severe disease. This is really important for the mandate debate. And it's important because normally we think about vaccines as providing both a private and a public benefit. I get vaccinated, I protect me, but I also protect you because I'm not likely to get infected and spread the disease to you. This vaccine has a private benefit. If I get vaccinated, I protect me against severe disease. On the other hand, the public benefit is much less than traditional vaccines. What then is the argument for a mandate in that setting? There just really isn't one. There's a good argument for telling people to get vaccinated. There's a good argument for encouraging vaccination, but to threaten people's job, livelihood, to create an outclass of people, an underclass, a new underclass of people around the vaccine makes absolutely no social sense, no sense whatsoever from a public health point of view. I think it's extremely destructive from a public health point of view.
Can I ask an important question there about what I've...
Krista, can we just stop for a second, just for a moment? And say, isn't that like the smartest, clearest thing you've heard about this whole vaccine mandate debate? Isn't it? I mean, and sorry,
it's just
Krista,
sensible, it's smart, and it's fact-based.
Exactly.
I agree. Okay, so but here's what I've heard, because I talked to a lot of people who completely disagree with you, with me, with Steve, with, I would say, the people who are being logical and just calm about this. And the new argument is as follows. The reason you have to get vaccinated is because unvaccinated people are causing the variants And those variants are the ones that are breaking through the vaccine. So if you had been vaccinated in the first place, there would be no variants that could break through. Can you help dispel that? Yeah.
Yeah. So the primary variant is in circulation around the world now is the Delta variant. The Delta variant formed before the vaccines were available. In fact, they formed in India basically as a product of the lockdowns in India. So the Delta variant, the vaccines were formed using the Wuhan spike protein, the original virus. The good news about the vaccines is that even though they were formed with the Wuhan variant, the original Wuhan virus, in fact, against the Delta variant, they still provide very strong protection against severe disease. That is incredibly good news. The variants do not evade protection against severe disease that the virus provides, that the vaccine provides. Actually, nor does it evade protection against severe disease and infection provided by by immunity that arrives after you've recovered from COVID. The variants actually, despite the argument that you laid out, Kristen, it actually doesn't change anything fundamental. The variants, the Delta variant may be a little more infectious. I mean, some people think twice as infectious. Whatever, we can debate about exactly how much. The relevant point is, do the vaccines protect against severe disease against the variant? The answer is still yes. Are you still protected if you'd had COVID and recovered? The answer is still yes. And then here's the fundamental point. Do we have a technology to stop the disease from spreading? And the answer is no. The vaccines don't stop the disease from spreading. The lockdowns certainly don't stop the disease from spreading. So the corollary for that is that you can theorize about the development of variants. There hasn't been one that's developed in the vaccine era at all. Again, Delta, developed before the vaccine era. I'm not seeing any evidence at all that there's a new variant that's emerging that's about to change everything. I mean, I think that's fear talking, not actual evidence. And we have a tool now to stop the epidemic. It won't look like stopping the epidemic. It won't look like the disease is gone. The stopping epidemic will look like people are protected against severe disease. That's what it'll look like.
So stopping doesn't mean COVID zero.
Yeah, I mean, I think people sometimes think about herd immunity as a synonym for COVID zero. Mm-hmm. We do not have a technology to get to COVID zero. Herd immunity, what it means is the disease will ebb and flow as the fraction of people in the population sort of get immune. Over time. This is a coronavirus. The immunity you get from it lasts quite a long time, but not forever. So if you recover from COVID, it looks like there's a study that was just published out of Italy, actually, in the Journal of the American Medical Association, that said that at 1 year, after COVID recovery, 3 in 1,000 people are reinfected. 3 in 1,000. COVID immunity is actually quite strong and long lasting, but it's not forever.
A year.
Interesting. 3 out of 1,000.
So, can I want to get to the natural to that protection, that kind of protection in a second, and why it is that it's just not accepted by the authorities here in America, whereas it is in Europe. But before we do that, I want to go back to your frame, which I think is so helpful, the private benefit versus public benefit, and put to you another challenge, just like Kristen did. Another thing that's thrown at people trying to talk about this sensibly is, well, the unvaccinated people are, this phrase you hear now all the time, they're clogging up the hospitals. They're clogging up the hospitals, and that means that you can't get treated. People with illnesses or emergency needs or cancer, whatever it is, that have nothing to do with coronavirus, they can't get treated. So the selfish unvaccinated people clogging up the hospitals. And my response to that has been, since when have we kind of discriminated about who gets to be, treated medically on the basis of whether or not it was something that they could be held responsible for? If you look at something like heart disease, I think I'm right in saying that a huge proportion of the incidence of heart disease is controllable by choices you make about diet and lifestyle and so on. That's my response. Am I right to have that reaction? What do you think about this clogging up the hospitals aspect of it?
Yeah, I mean, I can agree with you, Steve, on this. I think there's two aspects of this. One a factual question, and then a second, sort of an ethical question. So the factual question is, are the hospitals actually clogged up? And in the United States, for most of 2020, the hospitals were actually running below capacity, well below capacity. We passed the CARES Act. In large chunks of money went to hospitals to keep them not bankrupt because they were empty. People were scared more scared of COVID than they were of cancer or heart disease.
Right.
What's happened, if you look at the data, is that the levels of hospital use have started to track back up to 2019 levels. And while there's scare stories of hospitals running short of beds and so on, if you look at the actual data, it doesn't bear out that that's happened. Now, hospitals are meant to run busy. I mean, I don't know if you ever saw the show ER. I mean, it's always I mean, the drama comes from the hospitals running busy. So there's nothing, I mean, per se unusual about the hospitals being busy. There's also nothing unusual about doctors and nurses in hospitals that are running busy complaining about being busy. But it's not necessarily bad or wrong. The key thing is whether the hospitals that are running busy, it's not a hospital per se, it's a system, right? So if one hospital is running busy, do they have available places that they can send their patients? And for the most part, throughout the whole epidemic in the United States, at least, that's been true. That we haven't had shortages of the sort that you're talking about system-wide. Again, a particular hospital or other might run particularly busy. So that's the factual thing. There are policy things around this. Like if you're really worried about that, why not just expand hospital capacity? Instead, with these vaccine mandates, nurses are quitting, doctors are leaving. We're going to create shortages. The lockdowns created shortages too. Many folks stayed home instead of going to work so they could take care of their kids because of the lockdown. They couldn't send them to school. So I mean, the policy should focus on expanding capacity if really that's your concern. But let me talk about oh, please.
Oh, no, please. No, you go ahead.
Sorry, Kristen. Yeah, so, there's a quick ethical concern I want to, but a very important one. In the medical care system, the way that this is framed, it's almost the sense that the public owes something to the medical care system, the healthcare.
Yeah.
That's backwards. When you decide to enter medicine, you essentially are making a commitment to care for the public, not the other way around. The medical care system needs to adapt to the health needs of the public. It's not ethically right to ask the public to adapt to the needs of the healthcare system, which is, I think, completely backwards from the way that this discussion has gone. And I think a lot of the public that's making the kind of argument you were talking about, they're not thinking right. Like the thinking should be, we should ask the healthcare system to adapt to the needs that people have, and certainly shouldn't be excluding people. I've seen people actually say, a medical ethicist actually said that it's right to exclude, to not care for people who are unvaccinated. That is an extremely dangerous line to go down.
But we're going down it. I mean, you see,
yeah, we've seen it.
Right. I mean, there's that story about the woman who, is no longer eligible for a kidney transplant because she decided not to get vaccinated. I mean, I've never seen this in my lifetime, that we would treat somebody ill as a pariah. And if you could get to the point where, okay, maybe politicians are ugly people and they can do it. I mean, to see physicians acting like this, I mean, have you ever, what's the justification for it? And have you ever seen it before? I'm assuming the answer is no, but what the people who are doing it, what are they saying? It's so stunning.
I mean, I suppose it's possible in the past you might have. I mean, there's all kinds of unethical things that have happened in medicine, in the history of medicine. But in the recent past, in my training, we've never been told. I mean, that's just so far outside of my experience. I can't even begin to tell you how unethical it is. You do never. Much of modern medicine treats pathologies that are a combination of biomedical things, but also behavior. People don't exercise.
Yeah, exactly.
I mean, you don't not treat a lung cancer patient because they smoked. You don't. It makes no sense. I mean, it's a violation of medical ethics of the first order, as far as I'm concerned. And to somehow create this vast class of underclass people who are not deserving of healthcare, it's going to create a distrust of the healthcare system that will last a generation. it's gonna cause far more damage. The people that are arguing this way are playing with fire, and I hope they understand. I mean, I don't think it's going to. At least, okay, I'm kind of like people accuse me of having rose-colored glasses. I think people will come to their senses. This is not who people really are. They're still talking out of fear.
That's an incredibly so well put. I think you're so right. And what's really shocking to me about it is that this is being fueled from the top. And I'll bring a bit of politics into it here, which is that the language you see from the White House used against unvaccinated people is what's fueling all this. I mean, it's not just them, but the fact that instead of trying to calm it down and making the kind of arguments that you've made, you got the president, by the way, who was elected, saying, we've got to end this uncivil war and, bring the country together and unify and whatever. And especially the other week, there was an event he did, was it in Chicago? I can't remember. And he was just, vicious in his language against the unvaccinated and specifically on this point, this clogging up point. He was saying that, if you're not vaccinated, you are hurting other Americans who need medical treatment. He did it as clearly and plainly and bluntly as that. I mean, it's just really unbelievable. Can I ask you another... Just before we move off the adult vaccination question, you've said very clearly you're pro-vaccine, the vaccines work, and so on. One of the things that's been a theme of how you've approached this is assessing the risk to people based on the data and the facts of who's most vulnerable and so on. I think I'm right in saying right now, in terms of over 65s, people over 65, we're at 95% fully vaccinated, an extremely high rate, and then it declines with age. Do you have a view as to the importance of adults being vaccinated, choosing to be vaccinated, depending on their age or other risk profile? You just talk about that for a second.
Yeah, I mean, I think almost every medical decision, basically, I can think of very few that wouldn't think this way, should be a personalized decision. You should be talking about your health in conjunction with your physician and make a decision around your healthcare decisions based on that personalized attention. As a general matter, this disease is incredibly sort of has this bad effect on older people, right? So I think the survival rate for someone who's over the age of 70 is like 95%. So 5% mortality is a very high mortality rate for a single disease. For people who are younger, it gets better, right? So people under the age of 70, according to the World Health Organization, it's 99.95% survival, and it goes up with age. So like I'm 53. According to estimates I've seen, it's like my survival rate before I was vaccinated was 99.8% if I were to get infected. 0.2%. Every 7 years of age, you can double. So if you're 53 plus 7 is 60, 60-year-olds will have a 0.4% mortality. 67-year-olds will have a 0.8%. You can do the math yourself. So it's very personalized. The vaccine benefits are to reduce that mortality rate by 95%. Really, really sharply. It's a fantastic vaccine for that. At the same time, there are some side effects. Right. So especially if you're younger, especially young men from the mRNA vaccines seem to have a very high rate of myocarditis after the vaccine. High rate meaning somewhere in the order of, let's say, 1 in 5,000, 1 in 10,000. There's some debate about exactly what that number is. And the younger the men, the higher the rate. The same thing for the adenovector virus of vaccines like the J&J. It seems to, like, for young women and middle-aged women, it seems to increase clotting. And they all have some they may be unknown side effects we don't know yet, that we just haven't picked up yet. So what's the prudent thing to do? You're facing a disease that's really high risk for you. You're willing to put up with some higher risk and uncertainty around the vaccine because you're offsetting a very bad risk. On the other hand, if you're a young person, a very young person, the risk from the COVID is much lower, and you may worry about the vaccine side effects. And I'm not saying don't get the vaccine in that case. I say go talk to your doctor and make a decision based on what your own personal, sort of risk tolerance is and what your which if you're scared of COVID, maybe the vaccine is right, even though the risk. I mean, there's nothing wrong with that. I think actually that's a real problem, right? If you, I mean, I don't want to make little of that. I mean, if we've done in public health everything we can to make people scared of COVID, but that has real consequences. People live their lives. It should be a personalized decision, I think, and I think generally,
but it's not. Right, we're all about. They're about to say it's mandatory for 5-year-olds who have
let's do
essentially
that. Exactly.
zero risk. Yeah.
Let's talk about the children. I mean, that's let's come right down the age scale. So, them as Kristen said. I mean, look at what's going on. With our kids. I mean, you can't go to school. Your children can't be educated. They're certainly where I live, where we all live in the Bay Area. And we've got and in California you have this mandate now. What's your response to that, Jay? For kids, the mandate for kids.
First of all, I think I saw Gavin Newsom say this, like for 5-year-olds mandated vaccines, this vaccine, and he made a reference to other vaccines that children are often required to get, the MMR or the DPT vaccines. So the thing about those vaccines that are different for this vaccine for children is that those diseases are incredibly deadly for kids. Measles, mumps, rubella, diphtheria, pertussis, tetanus are all deadly for children. So the vaccination protects them against a real risk that if they were to get infected would harm them, a very high risk. This disease for children is vanishingly small in terms of the risk that they face. Is COVID. If COVID, thank God, when children are infected by COVID, have much milder reaction than older people do. And to date, I think the number of kids under 18 that have been killed by COVID are still even 20 months of data in, somewhere on the order of a bad flu season. I mean, we're 5 months of flu. So so you're protecting, by vaccinating kids, you're protecting them against a small risk relative to the other risks that the other vaccinations protect them against. So from a personal point of view, you're not giving them a lot of benefit. I think a lot of the argument for vaccinating kids is then as a public benefit, right?
Yeah.
If I vaccinate kids, I can stop the spread of the disease. Somehow, like, kids are the vector of this disease, which actually is not true. We can talk about the scientific evidence on that in a bit if we want. But the key thing is that from an ethical point of view, you don't vaccinate somebody for whom there is no private benefit or very little private benefit.
Long COVID, Jay, come on.
Actually, it's interesting. There's data out of the UK on that. That's really so. What they did is it's the Office of National Statistics in the UK, which is running circles around our CDC, by the way. What they did is they compared kids who were infected with COVID, followed them for months and months. But they had a control group of kids not infected with COVID and followed them for months and months and asked for long COVID symptoms, like long COVID meaning things like fatigue, headaches, things like that, brain fog. It turns out that the kids who had COVID had about 3% of them at 3 months on had at least one of these symptoms, and roughly the same fraction of the kids that didn't have COVID also had one of these these symptoms at 3 months. So for kids, I don't think it's such a big concern. I mean, based on the data I've seen out of the ONS in the UK. So I don't.
And I think most people don't even understand. Have never even read the studies on long COVID. The original study that scared everybody out of Europe, saying there was long COVID. The long COVID symptoms were things like a cough, a sneeze, fatigue. Like, if I ask my 7-year-old right now if she's tired, she's going to tell me yes.
Well, that's exactly. But I, by the way, that's like all the symptoms. I mean, doesn't it make you laugh when you go to these places, like around here? I don't know, like if other people experience this, and you see the list of, like, don't come in here if you're experiencing any of the following. Cough, tired, muscle ache, this, that, and you should think, well, who does? Like, every single one of them. Like, everyone's got that all the time, one or the other of them. It's so mad. Jay, there's something you said there. I just want to make sure I've got it down right, because it's so. It felt very fundamental when you're talking about the kids there. You said, is this correct? From an ethical point of view, you don't vaccinate someone if there's little private benefit Is that what
Yeah.
you said? I just want to make sure I got that right.
I think that's, I mean, that's right. Like, it's essentially, we don't commandeer everybody's, like a whole bunch of other people's bodies in order to make sure that I'm benefiting, right? It's that same principle. Like, we don't want to harm the person in order to create benefit for others. At the very least, you'd expect there to be some benefit for the person being back, where you're doing that medical intervention. Now, if it also generates benefits for others, that's great, right? But you don't ask somebody to be harmed in order to people may, your parents may like do things that hurt them so that they can help the kids. That happens, all the time, right? That's okay, but that's a voluntary decision. We don't ask in medicine to do that. Certainly, as a society, we shouldn't be asking people to do that, and certainly we shouldn't be harming kids to do that. Now, does the vaccine? Then that brings the question: does the vaccine on net harm kids? I think it's a close question. There's a big debate going on in medicine around that. I don't. For 5 to 11-year-olds, there's no data. It's not approved. I don't understand how Gavin Newsom can mandate a vaccine that's not even approved. Really, there isn't good data available as yet. The trials actually are interesting for the young kids. Is that it's not possible to show a benefit because the rate of severe disease is so low. You'd have to enroll an enormous population to show a benefit. And they don't have such populations enrolled. You'd almost have to enroll almost, like maybe the entire population, a very large fraction of the number of kids in order to show any benefit. So the randomized studies, what they are looking for is, does it prevent infection effectively? Does it prevent you from getting symptomatic disease or infection? Mm-hmm. It might work at that, but it's not going to prevent severe disease, or at least not going to be able to show it prevents severe disease because it's so rare in kids to get severe disease. So the studies won't show that it prevents the worst outcomes that we would care about. My kid dying. Studies won't show that. The randomized studies. They'll make the decision based on intermediate endpoints that are much, much less important than the outcome we actually care about. And so then for a governor to turn around and say, well, look, 5 to 11-year-olds, you have to do this. That's just unethical, right? It undermines the process by which these interventions are evaluated. And it creates a situation where, like, what's going to happen? Like, I don't vaccinate my kid, and therefore he's 6 years old. I'm not going to be able to send him to school.
I know. It's absolutely shameful. I mean, it's just, and again, I just want to kind of, I'm trying to sort of, I know we're literally recording this conversation and everyone can listen and watch. I feel like I'm writing all down because everything you're saying is such a fantastic riposte to the madness that is all around us. I mean, I hear, for example, just as you're talking there about the children, what is one of the stunning things is, I mean, they talk about misinformation. You have, educated people on the media. You got to assume they're smart, intelligent people. I hear them all the time on NPR, and you see them on CNN or whatever. Just this groupthink, and you hear them say, "Well, good news. Soon we'll have a vaccine for 5-year-olds. It's great. Well, I can't wait to be able to vaccinate my 5-year-old." Actually, what are you thinking? I mean, what have you been hearing that makes you think like that?
Yeah, I mean, I think, there may be kids with special needs for whom the vaccine makes some sense. I think there's a very small number of them relative to all the kids that there are. And so maybe that's an advance. I don't want to prejudge it. But that's something, again, that should be an individual decision. But what really bothers me is that we're not going to use kids as a way to stop the disease from spreading to adults, right? That's really what's fundamentally, I think it's that people are driving them. It's not like protection of kids. Mm-hmm. But that, again, doesn't work. The vaccine does not, after a few months, stop disease spread. Doesn't prevent infection. So I don't really
Can you talk about that a bit more? I think that was the data you referred to earlier. Let's just really get into that. If we've got a bit of time to do that, because it's so important, because that is a big part of the argument, which is, yes, we know the risk to kids are low, they say sometimes, but, they're the vector of transmission. And so if we're going to bring the pandemic to a close, we have to vaccinate the kids.
Yeah. Okay. So, there's a key piece of information that came from like early in the epidemic. There's a study in Iceland, a fantastic study, where it was actually kind of a systematic contact tracing study. They got like 12% of the Icelandic population that they sampled randomly. They found every single person that was positive for COVID. Again, this is like April of 2020 or May of 2020. And then they did a contact tracing thing. So if I, Steve, you and I were in contact, and you got sick and I got sick. Well, sometimes with those studies, it's hard to say, did I pass the disease to you or did you pass the disease to me? Here they sequenced the genome of every single virus that they found. And based on the mutation patterns of the virus, you can distinguish, if I have mutation A and you have mutation B at the same site, then we didn't pass the disease to each other. We must have got it from some other site. So they can tell. The striking thing that the lead author study told the press afterwards, there was not one instance in that study of a child passing the disease to an adult. Lots of instances of adults passing the disease to children. Children, for whatever reason, are not particularly efficient spreaders of this disease. It's not like a cold where kids, I had little kids, when I had little kids, I had a cold for years, right? Because they would bring home. But this disease is not like that. Kids are not efficient spreaders of this disease. So that was true. We knew that early in the epidemic. Since then, what we found is evidence that the kids don't. Kids are really not the like. I'll give you another study out of Sweden. There was Sweden had the schools open the entire epidemic. No masks, no social distancing. None of the kids died in this through all 2020 on this. And the teachers, this is a striking. The teachers had lower rates of infection than other workers in the community. It was safer for them to be in the school.
Amazing! I hadn't actually heard that.
Yeah, I hadn't heard either one of these, either the Iceland study either.
Yeah,
because a lot of people say there's no way to know how you got it, so they say kids don't spread it, but they don't know. And you're saying they actually do know.
These were both studies published in New England Journal of Medicine, like the most prominent journal in the peer-reviewed studies. And of course, they've received no attention, right? We've known this stuff all through the epidemic. So the kids are not particularly efficient spreaders of the disease. The vaccine itself. I can give you some studies, but let me just give you like something where everyone can see it. The UK is incredibly well vaccinated. They vaccinated all the way down to 18 and up. Iceland is incredibly well vaccinated. Israel incredibly well vaccinated. All of these nations incredibly well. The US incredibly well vaccinated, and yet we've had these enormous case outbreaks. Mm-hmm. And it's not kids spreading the disease. It's the fact that this vaccine does not stop transmission. There's a study out of Qatar that actually tracked very carefully the infection rates among vaccinated people, and found that by 5 or 6 months, vaccinated individuals were as likely as unvaccinated individuals to be infected. Now, they're still protected against severe disease.
Yeah.
95%. So, the data are coming out. There's a study out of Italy that suggests that 6 months the vaccine efficacy comes down to about 40 or 50%. So there's some debate about how fast that decline in protection goes. But the key thing is there's a decline in protection, and the macro effect is you see spread even in widely vaccinated societies. Vaccinated kids will not end this pandemic. It will not.
But that's the key point. So I think parents are so tired. Everybody's done with COVID. We want to be done. And it was unvaccinated Republicans. Then it was, then we look at the numbers of unvaccinated brown and black people. There's an inconvenient truth. So I kind of can't say that anymore. And now it's, we're going to be nebulous about unvaccinated. And now it's unvaccinated kids. So everyone, please, dear God, just go get your kids vaccinated. And then we can be done, because parents are suffering under this regime of, someone is COVID positive and then their kids are out of school for 10 days. So they don't perceive a harm to the vaccine, and they're just getting frustrated with like, my God, can you just please vaccinate your kids so we all can go back to normal? They think that's the end of it.
If that quarantine, Kristen, is really important. The policy is if a kid is tests positive, even if they have no symptoms at all, they hang out or in the same classroom with another kid, and they happen to not both be wearing masks, even if the kid they're in contact with is negative, this kid still has a 5-day quarantine or 10-day, like depending on the place, a long quarantine. Like what for? The kid who's positive, then even if they test negative a couple of days later, still has a 2-week quarantine, or it depends on the place. So I don't like. Essentially, we because we're doing this like repeated testing with no benefit. Right? Well, I say no benefit. Let me just say, like, if the goal is to stop the spread, it's not possible. Right? If the goal is to protect the vulnerable, well, we can vaccinate the vulnerable, which we've actually really done quite well at.
Yes.
Yeah.
So
why have we been such idiots about testing? Because another thing people don't appreciate is, look, there are a lot of people who needed to go to work. So if they tested positive for COVID, they didn't want a call from the county and a call from the state and everybody knowing their medical information. So it really got people averse to testing, at least adults averse to testing. Whereas in Europe and other parts of the world, I mean, man, it's like there's a test on every corner. So you can privately test and figure out whether or not you have COVID and then make a private decision about either your kid not going to school or you not going to work. But why in the United States have we had such a problem with getting tests out to the masses? Because that really seems like that would be more effective to stopping the spread of COVID, because you could test at night or test in the morning privately, know if you have COVID, and then self-quarantine.
You nailed it. You nailed it exactly, Kristen. In the United States, we have this idea that COVID is such a bad disease that every test should be publicly reported. I'm going to wear the scarlet C on my forehead because I had the COVID. Whereas if you and there's incentive effects around this, because it's not just that I get COVID. Now I'm going to get contacted by contact tracers who are going to like have me rat out who all my friends are because I happen to be around them. It's going to have consequences not just for me, but for my family, my friends, a whole bunch of other people. And so a lot of people, they don't want that. And it's completely reasonable that they don't want that. I talked to like some epidemiologists who are like, oh, no, of course everyone wants to be able to stop the spread. No, that's not true, actually. If it involves, okay, I can stay home because I'm sick, but then my wife has to stay home even though she's not sick, and now neither of us can work, and we go live paycheck to paycheck. I don't want to know that that I had COVID. That is how people actually reason in real life.
Yeah.
Right. Can I tell a story about that? And I know you have a great question, Steve, but the story made me insane, which is my daughter's friend tested positive for COVID. No symptoms, nothing, right? I mean, she's just fine. Okay. She tests positive. Not only did the school flip out, which is a whole story in and of itself, but what they did is they found out that there was a birthday party the day before the girl had tested positive for COVID. So all the parents voluntarily were submitting to the county photos from that party of my little girl, which you guys know how privacy focused I am. But so the county has photos of my daughter, and they're circling who's sitting near whom.
This is
and that's how it was insane. That's how they determined who was near this child, as if the child has the plague, and then determined the quarantine procedures from there. So I went totally, excuse my French, Jay, you don't know that I cuss a lot. I went ape shit over this.
Of course.
Of how dare you violate my daughter's right to privacy, my right to privacy, our family's right to privacy, and take a non-school event because you wanted there to be some quarantine thing and to go, aha, we found them maskless. So basically the whole class got quarantined because they were maskless the day before. The hysteria is out of control,
yes.
And it's leading to this complete like degradation in society. Now I'm not sending her to birthday parties. She can't go because I'm not going to have her subjected to who took a photo and who's going to give that to the state or the county. Yeah. This is crazy.
You see, the thing I very much ties in with what I was going to ask you to comment on, Jay, because it's the sort of how have we got to the point of the irrationality, the insanity that we see. I mean, just all around us, you see it. Just completely irrational things, like people wearing their masks outdoors, even when there's barely any incidents of transmission outdoors. We've talked about that before. On
a Zoom call alone.
What are you? The people in the cars. We've talked about that. Driving around in their car on their own, sometimes with the window down, wearing a mask. There's this. There's some restaurant I booked locally. The other and there's the stuff you get back on our protocols. This is now. This is not like right at the beginning when we didn't know anything about this. It's like right now. It's like if you have if you have to have the proof of vaccination, and then you be outdoors and wear a mask when you do this and you do that. And then if you have a child who can't yet be vaccinated, then you have to sit in a different part of the restaurant outdoor. Like it's absolutely insane. But it's been fed by. I mean, it was easy to blame the media, but my real question to you, Jay, and actually I want to wrap into it the question about the natural protection you get from having recovered from COVID. In Europe, the EU and other places, that is considered just as effective as being vaccinated, and you can use it the same way as a proof that you can enter a building, whatever it may be. They treat it the same as being vaccinated. But here in America, the whole approach seems so divorced from science and reality. Why? I mean, why? They're not, again, they're not stupid people, Fauci and the CDC and all the people who are setting these policies, and then it trickles down to the state level and then to private business. They're not idiots. I mean, we can use that word, insulting, idiots, but, they're actually not. They're smart. How is it that it's so irrational?
Yeah.
I mean, I think, so there's two parts to that question. One is like the public at large. I think the policy has been to create fear in the public that everyone is at equal high risk from this disease. And when you've panicked the public as part of policy, essentially, for 20 months, you're going to get irrationality. You're going to get divisiveness. You're going to get crazy things happening. People demanding things that really don't make any sense, just as a way to sort of manage the fear that they feel. I mean, I have a lot of sympathy for the public because of that. Because I think we in public health have done an incredibly poor job around. I mean, I had thought that a principle of public health messaging was to never panic the public. Give accurate information, give reassurance, give tools to try to manage the risk, but never panic, because panic only leads to what you're describing, like irrational behavior that doesn't actually do anything good, other than, in fact, might create quite a bit of harm. It has. So I think that's one thing. I think so. On the other side of this, the smart people, the intelligent people, the class, essentially the ruling class, like what's happened is, we've replaced our democracy with a biosecurity state. Like a democracy, a liberal society has plural goals. You want something, I want something. We all work toward different sets of goals, and that's okay. That's good. We sometimes we cooperate, and sometimes we might come in conflict, and there's mechanisms to try to resolve the conflicts. And it's a liberal society works toward, allows there to be a plurality of goals that people have. We've replaced it with a biosecurity state, where the only goal of society really is to stop the spread of a single infectious disease. And it's the smart people that should have known better didn't realize the harm that they were causing by replacing a liberal society with a biosecurity state. They thought that you could continue to have a liberal society while still saying the only thing you should care about is COVID spread. But it turns out you cannot. A lot of things go by the wayside. I think Australia is a fantastic example with the sort of the end point of this. Maybe China is probably the most fantastic example of this. Right? You organize everything around that, and you're gonna get these kinds of irrationality that much that you cared about will fall away as a result of it.
Wow, I mean, it's so true and so frightening. And actually, it brings me to another question I've been eager to hear you talk about. We never get the time, when we talk on TV about these things. You've stood out against this madness from the beginning, and you've been, attacked and vilified by your own university, of course by the establishment, but you've also seen a lot of support. So I just love you to talk about the experience of the that you've been through, the Great Barrington Declaration, the response to that. Not just that, but that's been a big part of it. And of course, and that came quite a few months into the whole rebellion that you led. I mean, you were one of the original rebels against all this. Tell us what that's been like for you.
Steve, I have to say, the first time we met was on your show in, I think it was like April or May of 2020. I was completely naive about a million things. And I'm very pleased you were kind to me on this, on it. I mean, I think, but I did see that there was something not right in the strategy. Like, in fact, we talked about focus protection on that show as the right strategy even before the Great Barrington Declaration. It's been shocking to me. Like, I had always thought of myself essentially as a scientist. Like, I'm trying to write papers that are persuading people about certain, based on data, and I'm not trying to do politics. I actually have never signed up for a political party because I'd always viewed myself as I want to be able to speak to everybody. And if a political party membership gets in the way of that, I don't want that. What's happened during the pandemic is that I've come to realize that the scientific discussion in this context is not nearly enough. Like, there's the science, and then there's the political environment around which it's covered. And I think for me, it's been really challenging. Like, I've lost so many. I've lost respect for so many of my friends who have let their political beliefs get in the way of what I know that they're capable of. I've lost, and they've lashed out at me personally. They've lashed out at people who disagree with them, as if it's it's not okay to disagree about scientific facts or have scientific discussion or debate. It's Stanford in particular has been really. I've managed to speak out in almost every other place on earth that people have, but on Stanford campus, I actually have not. There hasn't been any debates at all organized. It's been interesting. You'd think a university would be open to having these kinds of discussions, but in fact, it's been quite hostile. And I don't know how to repair. I mean, I've been to Stanford for 35 years. It's the most. The motto of the university is "Let the wind of freedom blow," or "Let the winds of freedom blow." They just haven't blown very, very much the last few years. On the other hand, I have. As a compensation for this, what I found is a common cause with so many people who see the problems that we've been talking about, that understand that the response is not right. There's something really deeply wrong with it. And I think it's interesting because, like, I think it's people that like some of the people are that I'm now allies with are on the left. Some of the people are allies with are on the right. And it's what we share is not politics, small p, tribal politics. What we share is a deep commitment to a liberal society. You
said you're optimistic so when does this end, and why are you optimistic?
Well, think about how bad it was last year at this time. We wrote the Great Barrington Declaration because we saw the lockdowns were coming back. Can the lockdowns come back? I don't think so. Are they going to close schools again? I don't think so. I think we've made a lot of progress in the last year. The movement to oppose these COVID restrictions is just growing. I think many people see now the irrationality of it and the dangerous road we're headed down. There's still a lot of fight left, I think, but I do think that in part because of the vaccines, and in part because of fatigue around the restrictions, people are starting to wake up around this. And the awakening, I think, will come all at once, right? Well, one day we'll all say, "What on earth were we doing?" And then we'll look around and just like coming out of a nuclear bunker, and say, "Okay, well, the daylight's still there, the sunlight's still here. Let's live in it."
Yeah. Well,
maybe college football's our hope.
I love those videos.
Let's go, Brandon.
Well, I do. Let's go, Brandon.
I think that I don't know. Jay, we better leave it there for now. But actually, there's a whole bunch of other stuff that I would love to talk to you about. Perhaps we could put it in that category of reflecting on what happened and looking back on it, because we've had a great discussion today about the current stuff that's still live. And I honestly, what you've been saying about the vaccines and all the rest of it's just been so clarifying and helpful for me. But actually, it is worth talking about how that lockdown mentality got going, the origins of all of that, what we need to learn from that for the future, and so on. So I think we should do that and have another conversation about that, and just make sure that we look clearly backwards as well as forwards. But Jay, that was fantastic. Honestly, I can't tell you, just such a delight to have the time to talk about these things with you. in an extended way, and just hear your calm, clear, scientific take on everything. Thank you.
Thank you, Steve. Thank you, Kristen.
Yeah, thank you, Jay. That was fantastic.
Well, that was just such an amazing conversation, so informative. I mean, anyone who is wrestling with this question of the vaccine mandates, an employer or someone who's still trying to say, I don't want to get my kids vaccinated. Why are you making me do it? You've got all the arguments you need right there, scientific arguments from Dr. Jay Bhattacharya. So make sure you tell them to follow us on Apple, Spotify, YouTube, wherever people get their podcasts. Make them aware of all the great information that was in this particular episode. Of course, we hope all our episodes entertaining and informative, but right now we're all in the thick of this argument about the vaccine mandates and all the rest of it. So incredibly useful information there today. Kristen, I absolutely loved that conversation.
I agree. I feel like today's episode was like the cliff notes of the truth.
Exactly right. Exactly. And as we were saying, it's so shocking that the groupthink out there, the way that this conversation is being had by everyone else, is just so divorced from reality. I'm so pleased we're able to push back a little bit on that today with science and truth and facts.
Right. We got to have them back.
Exactly. We will do. Great to have you all with us today. Make sure you come back soon for our next episode, California Rebel Base. See you soon.
Bye, everyone.